thanks for having me here today. I'm always excited and happy when psychologists get invited to come to talks about medical illnesses, because at least that means there's a recognition of the impact of psychological health on your children. As Tricia was talking about a little bit today, there's these different kinds of mental health professionals that are kind of out there. And I just wanted to kind of just give you a little bit of information about what a pediatric psychologist is as compared to other kinds of child psychologists. Pediatric psychologists are child psychologists, so we have all of the same training and background in emotional and behavioral health that impact children and adolescents. But on top of that, we've had some extra training in sort of that intersection between physical health and emotional health. So we work with kids who have acute illnesses or chronic illnesses and how that impacts their emotional well-being. So today I'm going to actually be talking about family adjustment to chronic illness. I'm going to talk a little bit about both parents and siblings and how people are coping. So before I start, I do have a little bit of a disclaimer, which Tricia had the same one, which is that unfortunately there is just no information in the psychological literature about PHACE syndrome. And actually there's even very little information about facial differences. So I did the best I could to kind of pull relevant information, but recognizing that it's really chronic illness as a whole and how that impacts families, as opposed to very specifically how PHACE impacts your family. So I wanted to make sure that we all kind of understood what we're talking about by psychosocial adjustment. It's kind of a psychological term that we throw around quite a bit, but may not mean quite as much to you. So it's a very simple concept, actually. It just means the emotional and social response that you have to a negative life event. So something unexpected and unwanted has happened, and it's how you are responding to it emotionally, and then how it's impacting your social relationships. So people ask, why is this important to really talk about parental adjustment? These are our kids. We're very focused on their health and their well-being and their emotional response, but spending less time kind of focusing on how you as a parent are coping. But your coping is actually extremely important. One of the reasons is because we know that caregivers of children with chronic illness are at much higher risk of having depressive symptoms. In different studies, it ranges what they find, but anywhere from 13 to 38% is kind of what's out there right now. And this is both moms and dads being at risk of this. The other thing that we know is that how you respond and how you think about your child's illness and the impact that it has on your family is actually a much more important predictor of outcome than the severity of your child's illness. So we could take two completely identical kids and put them in different families with a parent who's responding well and then a parent who's not adjusting very well. And the family where the parent is adjusting well is going to be much more successful and have a much more positive outcome than the family where the parent's not adjusting well. And then the final reason that we really want to talk about it is because there are a number of consequences of poor adjustment, and these are negative consequences which we'd like to avoid. Obviously, if you aren't functioning well, the impact on your ability to care for your children is going to be decreased. But in addition to that, we know that in families where a parent is adjusting poorly, the kids actually also have poor adjustment. And that doesn't just happen in childhood when you're living with your parent, but that poor adjustment actually follows through to adulthood. So you're sort of setting kids up for a bit of a pattern depending on how you adjust. Now, when we talk about adjustment, obviously we recognize that you aren't going to get the diagnosis and like that very moment go, oh, I'm doing well and I'm coping with this. That would be very unrealistic. So obviously it's kind of a journey. So in the beginning of the journey, you are going to have a number of emotional reactions that would be extremely normal. Obviously, you're going to feel helpless because you don't know anything about this illness and you want to help your kids, but you don't even know really where to start in that process. I think a lot of parents also start to re-examine details of their pregnancy, and this is really related to guilty feelings. So questioning, did I eat the right things? You know, should I have exercised more or less? Is this my genes that I passed on to my child? So there's this really pervasive sense of guilt early on. Also a lot of anger that's directed at the outside world and the threat that the outside world holds. So it becomes this like me and my family against the world. I'm gonna protect my child from any threat that might exist in the world, from teasing and from other people who might stare, because I love my child, and so there's a lot of anger about that. Obviously, I think grief is one of the most pervasive feelings that families struggle with. When you're pregnant, you have all of these ideas and notions about what that child is going to be like, what their future is going to be like, and then when you get a diagnosis of some kind of illness, that ideal really essentially kind of dies or withers away as you learn what your actual child's life is going to be like and some of the challenges that they're going to face. And then I think another feeling that families also can struggle with is resentment. So, resenting other friends and family who have healthy kids and really take that for granted and focus on things that probably start feeling like very minor issues that you wish people would just shut up and stop talking about. Early on, lots of different social challenges that I think parents face. Those first trips out to the grocery store or the park or to your, the school with, pick up other kids. These are really some of the most difficult times because it's the first time you're going to be taking your baby out into the world and allowing the world to see your child. Obviously, there's a sense of wanting to predict everything that people are going to say and do the best you can to avoid those situations. So I think parents become very vigilant about who's looking at me and who's not looking at me and what am I going to say to prevent this. So in one of the studies I was looking at, a mom said people kept wanting to look in the stroller to see what my baby looked like, and I felt like I had to tell them very quickly what was going on because I hated that shocked look on their face. I didn't like seeing that expression. And so feeling a need to explain all of this information in order to prevent people from having a reaction. It's very common to have difficulties in those early moments. In a study with kids who had a cleft lip, so another facial difference, but obviously a bit different, but 76% of parents reported anxiety about going out in those early months. So it's very common. As Tricia was talking about, taking photographs is also part of normal development. That's how you document those early days. It's your way of kind of showing other people the pride you have about your child. So when we sometimes as parents, I think, have difficulty then showing those pictures to people, because either we feel embarrassed or we don't want to have to deal with the questions, that I think that also brings up a lot of those guilty feelings again, like I'm proud of my child, I love my child, why am I having such a hard time sharing these pictures with people? Or feeling like, I know that this facial difference is going to gradually get somewhat better than what we're seeing right now, so I feel like it's not fair to take pictures because that means later on my child's going to have to see what they looked like, and now it's so different, and that seems like it's an unfair thing. But obviously, for your child's development of self-concept, as Tricia talked about, taking those photographs is a very important thing, and it is important to document those early times. So if we just look really specifically at the impact that facial differences have on moms, so I'll focus on moms for a minute. In this particular study, they compared kids who had a facial, these are the moms, of course, moms of kids who had a facial difference, moms of kids who had a chronic illness but it wasn't a facial difference, and then these typically developing families and children. So when they compared all the groups together, they basically found that The facial difference group and the chronic illness without facial difference group were really experiencing some fairly similar risk factors and some fairly similar stressors. So, kind of what that tells us is that there's this overall risk of difficulties adjusting, and it really has to do with just the stress that comes with raising a child with chronic illness, as opposed to, having specific things that are specific risks because of having a child with a facial difference. So when they looked at these two groups, what they found was, in comparison to the healthy developing families and children, moms were much more distressed, much higher stress response. They also were pretty negative in their evaluation of themselves. So saying things like, when I think about myself as a parent, I have doubts that I can handle this. And then there was some impact on the marital relationship, not necessarily saying that the marriages were more dissatisfied or more at risk of ending, but that there was greater distress and disagreement in the relationships. So, not going to let the dads in here get away so easy as to think we're just going to focus on moms. Unfortunately, though, in the research, they actually do mostly focus on moms. So I had to do a little bit of digging to find out how dads are doing. Now, the reason that most of the research is focused on moms is because historically, mothers were kind of viewed as the primary caregivers, and we then said, well, if you're the primary caregiver and you're dealing with all of the stress of caretaking for a child with a chronic illness, obviously you're going to be more distressed. But what we now know is that many fathers are also taking on these caregiving roles, and so they become also at increased risk for parenting stress and psychological distress. However, while it becomes kind of a risk factor, the more involved dads become, we also know that it serves as this resiliency factor that promotes more effective coping with parenting stress, healthier family functioning overall, and better marital satisfaction. So the more involved dads are, the better that the marriages are functioning, the better the partners are functioning, and the healthier your family is then functioning. And it really seems to make, I think, just general sense that if both partners have the same degree of information about medical knowledge, you're both involved in medical decision making, that's going to increase your sense of satisfaction and connectedness in your marriage. So you're probably going to have a much more satisfied and marriage that's kind of more bonded closely. So just briefly kind of touching on the impact that chronic illness does have on marital satisfaction. Without a doubt, having a child with special needs does increase the role strain. And basically what we mean by that is that these are the different stressors that are associated with the role of parenting. So when you're talking about division of labor, who's going to go to the doctor's appointment? Who has to take off work to go to that appointment? Should we both be there to get the same information? Is one parent going to pass on the information to the other? There can be role conflict, so feeling like my role as a mother is taking over my role as a wife, and I'm having a difficult time balancing these two roles that I have. And then that can then lead to more emotional exchanges. So partners being more emotional with each other, and not in a good way. But what we know is that marital satisfaction is actually a much more complex phenomenon than just saying you're having role strain and that's going to lead to dissatisfaction. It's really this transactional model where we see partners mutually altering one another at all times, so it's also kind of a fluid process. So individual factors like how well you're actually coping, your mood and the impact that then has on different relational variables, like how satisfied your partner is, how much they feel like they're being supported in the marriage, that those together really have an impact on marital satisfaction, not just one versus the other. And just to again give you a sense, in a study that I was looking at, when they were talking to parents about the impact that this was having on their marriage, 68% of parents said we've really come together. We've really bonded on this issue, and it's actually made our marriage stronger. 24% said, you know, we're getting through it, but we're really struggling, and our marriage has taken a bit of a hit. And then 8% of parents separated. So does this necessarily mean that your marriages are going to be, you know, at great risk? No, but I do think it's something that you have to keep in mind because it does increase the risk of difficulties. So I wanted to just break it down by poor adjustment and then good adjustment and what predicts these different things. As you look down this list, you're going to see a number of different variables. And what I want to point out that you do not see up there, and that's for a reason, is your child's medical status and the duration of their illness. And that's because that doesn't directly predict how well you're going to do. What does predict poor adjustment is having a really limited social support network. So if you don't have people that you can rely on, people you can call up and talk to, going online and chatting with other families, your adjustment is probably going to be much poorer. Parents who have emotion-focused coping also do much more poorly. And what that basically entails is this coping style that's defined by being in denial, just saying, I can't handle this today, I'm not going to deal with this is too much for me, and this is your normal strategy, so you're never really addressing any of the issues that are happening. Also, self-blaming, so saying, I really should be coping with this better, and I should do something different, but then never taking the steps to actually do anything different. If you have any other stressors in your life, your ability to cope overall is going to go down. So if you have increased marital problems already going into this, or if you have financial stressors, that's also going to make your ability to cope lower, and you're probably going to have poorer adjustment overall. And then less open family communication. So if you feel like you can't talk to your partner, or you can't talk to your parents as grandparents, and you feel like you're always justifying things to them, that's going to be much more difficult. So, moving on to happier things, what predicts good adjustment and well-being? First and foremost is just kind of having this flexible and adaptable way of coping with issues. So these are the people who kind of roll with the punches. If something happens, yes, it's a challenge, but they recognize the challenge and they kind of address it and move on. Supportive social network goes along with that. Being able to balance your child's illness with other family needs. From time to time, we see families where there's the ill child, and basically the entire family is revolving around that child. So every decision that's made, from dinner times to bedtimes to doctor's appointments, everything's revolving around that, which makes it very difficult to balance the other needs of your family. So if you can make that balance, you're going to be in a much better position. Effective communication, and then an active coping style. Active coping style, as opposed to that emotion-focused coping that we were just talking about, is really defined by being very problem-focused and solution-focused. So you recognize that there's a problem, and you move forward in creating a solution and activating that plan. These are also parents who typically use what we in the psychological world call cognitive restructuring. And basically, cognitive restructuring is, a single event happens, and it can be a neutral event, but it's the way that you think about and talk to yourself about that experience that really defines how well you do. So if you're in the park and you see another child kind of pointing and staring at your child, you could in your mind say to yourself, well, look at that kid, what a rude little kid, and what rude parents to not intervene and make their child stop. Or you could be more solution focused and say, okay, how am I going to handle this and make this a teaching moment either for my child or for that child. So what are some of the strategies to improve your adjustment? Obviously, I think it's very important to recognize that you're going to have a number of different feelings, and just allow yourself permission to really experience them. Know that they're kind of transient, they're going to come and go. Also recognizing that your ability to accept your child's illness and that journey to acceptance is a really individual experience. And this becomes very important when we're talking about two partners who may not be on that same journey together, maybe in a different place. So you have to be able to recognize that you might be in different positions and respect that that's where the other person is at. As the family talked about yesterday, it is good to get information, but you have to be very careful where you're getting that information from and whether or not you're overwhelming yourself with that information. It's very easy to go online, type in any search term you want, and a million pages are going to come up that you can choose from. But it's easy to get overwhelmed by that information and get stuck in reading some pretty negative things. So get information, but do it in measured doses. And also recognize that, yes, you will need to make decisions about your child's medical future, but just because you know you have to make those decisions doesn't mean you have to make those decisions like in that moment right then. So give yourself time to ask questions and get the answers you need. And then finally, seeking support. We've talked a lot about support as I've gone along today, but it is so important. So being able to reach out to other people. And I think that's part of the reason why a conference like this is so fantastic, because people can come from all over really the world in order to interact with one another face to face in a way that you can't otherwise. So I really like reaching out to other families who are going through something very similar, because you guys have much more practical advice for each other than probably even Tricia and I have as mental health professionals. And then be mindful of some of the friendships that you already had. It's very common for friends to avoid you in the beginning because they're scared they might say something wrong. And I think it's also common for you to want to avoid friends in the beginning because their normalcy can be difficult for you to tolerate in the beginning. So just recognize that those early interactions do not necessarily define a friendship, and that those are going to be very important people for you to rely on in the future, so don't give up on them. All right, so moving on to siblings and how they adjust. Siblings, we talk a lot about sibling risk, but I think people sometimes want to just kind of see why they are at higher risk. I think obviously the most, sort of the biggest factor is that they receive less time and individual attention from you. So as you're spending more time with your child who has chronic illness and you're running to the hospital and you're doing procedures and you're looking up stuff online and you're talking to other families, this pulls away the time and attention that you have to give to your other kids. Families, like I mentioned earlier, can become organized around medical needs. So that would mean that the needs of your other children, their activities, their friendships, those all kind of get put on the back burner, which really does interrupt their day-to-day life. Sibling relationships can also become quite strained and lead to higher risk. So I've had siblings come before and say, I kind of think that maybe I caused this because I told my brother or sister that I hated them and that I didn't want them to be alive anymore, and now I think that I've created this problem. Obviously we know that that's not true, but if you're not getting accurate information, you could see how a child could think that. A lot of resentment and jealousy because kids who go to the hospital get lots of gifts and they get lots of attention and they get visitors, and brothers and sisters wish that they could get some of those things sometimes and they aren't. Shame because they feel embarrassed about their siblings' appearance and they feel like that's not a normal response. Anger because they have increased responsibilities now. And then I think there's this pressure to be the good child, which comes both from parents and then from within. So from a child's perspective, they feel like, I really have to be good and I have to do all the right things because my parents already really stressed out and I want to protect them as best I can. And then parents often will also say, you know, I'm under so much stress already. Can't you see how difficult this is? Why are you, you know, having a tantrum now? This is, you know, I can't handle this today. So all of this in total really can lead to greater stress in the sibling than in the child who actually has the medical condition, because I think we're so cued into, you know, what's the child with the diagnosis thinking and feeling, and we're always watching out for them, but siblings can become kind of the forgotten ones. So how are siblings doing? Well, there's kind of a mixed picture in the literature. Some of the studies have come out and said, you know, these kids are looking like they're at pretty increased risk for psychological stress, particularly of internalizing disorders like anxiety and depression. Other siblings appear to actually do much better because they live in a family where they have a sibling with a chronic illness. Positive outcomes include being more caring, more mature and supportive, more independent. So, you know, overall, siblings appear to do a variety of things, but what we do know is just like in parent functioning, there is no direct relationship between the presence of an illness and sibling functioning. It's a much more complex picture than that. So I wanted to talk about this study because I think this really captures that complex picture that I was just speaking of. So in this study, we had mothers completing information about their children's functioning. So the families had a sibling with a visible facial difference, a sibling with an invisible facial difference, like a cleft palate, so something that you can't see but it's still a chronic illness, and then they had healthy kids. So what they looked at overall was how are these kids, how are these siblings functioning as compared to the families that have healthy children? And what they found was that there really weren't any differences. They were functioning just like any other child in relation to their emotional and behavioral well-being. But when they broke it down and just looked at the facial differences groups and they compared the visible to the invisible facial differences group, they found that kids with a sibling or brother sister who had a facial difference, they actually had worse behavior problems as rated by their parents. But they also had better social competence. So they're behaving more poorly, but in other respects they're more mature and they're handling themselves better. But it becomes much more complicated than just saying, okay, kids who have a brother or sister with facial differences function in this way as compared to other kids. So they were looking at how parent report and parent functioning really impacts sibling or their child's functioning. And what they found was the less parental support that a parent was saying, you know, I don't feel very supported, less marital satisfaction, and increased depression in the mom, all related to increased behavioral problems in the siblings. So we ask ourselves, are siblings of kids with a facial difference really struggling more? Or is this really about overburdened parents who are modeling maybe poor emotional control? So if you're showing your kids it's okay to scream and throw things when you're angry, well, your kids are probably going to scream and throw things when they're angry. Or is this about overburdened parents who just are having a difficult time coping with normal childhood behaviors? So I wanted to go through this study because I think this actually does a better job of sort of laying out all these different factors and what it is that goes into sibling functioning. So much bigger study. Families were either impacted by developmental disabilities or chronic illness. In this particular study, the children themselves filled out their own questionnaires, and then parents filled out some questionnaires about their own functioning. So what they looked at was sibling knowledge of the illness, sibling mood, attitude toward the illness, self-esteem, social support, behavior problems, and then parent mood, family cohesion, which is kind of how bonded your family is, and family income. And this is what they came up with, which is a little bit complicated, so I'll go through each one. So first and foremost, higher income led to better mood of the parent and fewer behavioral problems in the kids, which is all great for us to say, but we can't dictate who has better income and who has lower income. So that's not really the most helpful finding for us. But I think it certainly demonstrates that if you have more financial resources and less stress in other parts of your life, it's easier for the parents to cope better, and then kids are doing better as well. So the second finding, they looked at a few other factors besides income. So strong family cohesion, so your family is very connected. Kids who were older, kids who said, I feel very supported and I have a large support network and I understand my brother or sister's condition, they actually all had fewer behavioral problems. So that sibling knowledge really impacts the attitude toward the illness, so the more you know about it, the better you feel, the better kids are saying, I can cope with this, I don't feel like this is disrupting every moment of my life or my family's life. And then the last one, which I think is really the most important finding here, is that better parent mood leads to more family cohesion, which then leads to better behavior, better attitude, and an increased sense of support in kids. So I think the takeaway point here really is that your mood and your ability to demonstrate good adjustment really strongly predicts how well your family adjusts and how well your other children adjust. So the stronger the bond between family members, the more likely that well siblings are going to demonstrate good behavioral adjustment and an improved attitude about their sibling's condition. And I think this also then demonstrates that kids really want to know about their brother or sister's condition. They want to have accurate information, and the more information they have, actually, the better they do. So just to kind of wrap things up, and Tricia really touched on this, so I'm not going to go into a lot of detail, but these are just some different symptoms of stress in kids, broken down by different kind of domains. But basically you're looking for something that's out of the ordinary for your child and becomes a bit chronic. It's not just lasting for a day or a couple of hours, but it's going on for a couple of weeks. So fostering resiliency in brothers and sisters. Obviously we talked about providing age-appropriate and accurate information about the sibling's condition, very important. And what we would say, in like a school-age child, we would expect them to at least know the name of the condition and some ability to explain it to somebody. So if someone approaches them at school and says, hey, what's going on with your brother or sister, you could at least say what it is and give a very brief, sentence explanation of it. For some siblings, being able to participate in some of the medical life of their brother or sister is helpful. So, running and getting bandages for mom to help out, going to doctor's appointments can sometimes be helpful, but just letting them kind of into that world so it's not like there's two separate worlds in your family. So those are sort of related specifically to siblings who have a chronic illness, but fostering resiliency in general, one of the most important things is just to normalize adversity. So teaching your kids that you will absolutely have challenges in life, everybody has these challenges, but they're manageable. And here's how we're going to address each of these challenges. And then I put the last one in because obviously just as you need social support, so do your children. They can find this in a variety of places, schools or places of worship, other families or other family members. But there is a program called the Sibling Support Project, and I don't know if any of you have ever heard of this, but it's a fantastic program. And it's national, so it's dedicated to the challenges that brothers and sisters face when they have a sibling with a chronic illness. And they do these programs called Sib Shops, which are opportunities for brothers and sisters to get together and talk about how difficult these situations are, and then just to have fun. So it serves almost like an online support group or a person-to-person support group for your kids. So a place for them to connect with other kids going through something similar. And then just some other ways to help your other children. This is all kind of common sense stuff, but I think it's important to just reiterate that you do know what you're doing and you are doing the right things. So I think parents really hear that moment where they get a question that they don't know how to answer, and they think, oh my God, I should have the right answer for my child. I should know what to say to them. But it's okay to say you don't have the answer. It's also okay to recognize that sometimes your kids are going to come to you and the problem that they're going to talk about is going to need a solution. And sometimes they're just going to need some empathy. They just need you to be supportive and caring and listen to them. So knowing the difference between problems that need solving and problems that just need empathy. Asking open-ended questions. I think in Tricia's presentation she talked about having family meals or a place in a time where you're all kind of sitting down together and you're just having conversation about your day, which allows your kids to really bring up issues that are going on for them. Using books to normalize their experience and to teach them coping can also be helpful. And in the front flap of your binder, there's a list of different books that deal with just different kinds of self-esteem, sometimes having facial differences, some books for siblings. And then finally, be a role model. So teach your kids how to cope well. Take care of yourselves. So eat and sleep and spend time with friends. And when you're feeling stressed out, take some time for yourself. All of these things really do have a trickle-down effect, and your kids are watching you. So if you're doing well, they're gonna copy and do some of the same behaviors.